Let's talk about prevention and vaccination in COVID-19. So our objectives will be to outline the COVID-19 safety measures and prevention strategies in long-term care facilities, state examples of various types of vaccines, recognize the most common vaccine side effects, and recognize the vaccine's effectivity. Let's start what we can do to prevent COVID-19. Okay, so it's stated that to wear a mask prevents COVID-19 spread. Stay 6 feet away from others. Avoid crowds and poorly ventilated places. Wash your hands often. Cover cough and sneezes. Clean and disinfect your area once you use it. And get vaccinated. So COVID-19 prevention strategies in long-term care facilities. What did we do when the pandemic first started and the long-term care facilities were hit by the pandemic? So we restricted visitation. We communicated with residents and families so they knew the status of every patient in the long-term care facilities. We restricted non-essential healthcare professionals to the facilities. We educated non-essential healthcare professionals and healthcare professionals to how to deal with the pandemic and how to prevent it. We practice social distance of residents, monitor healthcare professionals and residents for fever symptoms of respiratory infections frequently so that they could not spread the infection, implemented infection and prevention control practices, notified the health department and other facilities if there were any increase in cases among the facilities, and assessed inventory and provide necessary supplies to always have protective supplies in need. Let's talk about vaccines and COVID-19. COVID-19 vaccination has been implemented in the variety of settings. They're already in state and local health departments, healthcare sites and hospitals, in most vaccination clinics. Long-term care facilities already are being provided with the vaccines, and retail pharmacies have the vaccine. As of February 27, 2021, already 72 million doses have been administered, 48 million people have been initiated a series, and more than 7 million doses were administered in long-term care facilities. Right now, vaccination costs are provided by the U.S. free of charge, and the health system or health department could incur cost of vaccines implementation in clinics. Let's first talk about the Pfizer-BioNTech COVID-19 vaccine. So what are the indications? The indications is for people currently older than 16 of age, and it is 2 doses, 21 days apart. Okay, so what is the benefit and effectiveness? In 43,448 participants, 16 years and older, who were followed for 2 months, it showed a 95% effective in preventing COVID-19 disease and 100% effective in preventing COVID-19 associated hospitalizations. Deaths were uncommon. 2 were in the vaccine group and 4 in the placebo group, and the 2 deaths in the vaccine group were not found to be related to the vaccine itself, side effects. So, safety or harm. The most common side effects were pain at the injection site, fatigue, headache, muscle pain, fever, and joint pain. The Moderna vaccine. Its indication were in individuals 18 years of age or older, and there are 2 doses, 28 days apart. So the benefit or effectiveness, it was studied 30,000 participants, and it was found to be 94% effective in preventing COVID-19 disease. It was 89% effective in preventing COVID-19 associated hospitalizations, and deaths were uncommon, 6 in the vaccine group and 7 in the placebo group. The safety or harm, also most common were pain at the injection site, axillary swelling, tiredness, headaches, muscle pain, and joint pain. The third vaccine is the Janssen COVID-19 vaccine, or most known, the Johnson & Johnson vaccine. Its indications were persons 18 years of age or older, and it was only 1 intramuscular dose. Its benefits or effectiveness were found to be 66.3% effective in preventing COVID-19 disease and 93% effective in preventing COVID-19 associated hospitalizations. Vaccine efficacy against all-cause deaths was around 75%. The serious adverse events were found to between the vaccine and placebo to be equal, 0.4% versus 0.4%. Severe reactions were more common in the vaccine recipients, and grade 3 reactions were reported by 2.5% of vaccinated versus 0.7% of placebo group. Grade 3 reactions were any reactions that needed a prescription pain reliever or restricted physical ability and caused any type of swelling. So let's talk about general vaccine reactions. These were most common seen within the first 7 days of vaccine administration. They were seen pain at the injection site, systemic reactions were common, fatigue, headache, and myalgia were the most common reactions seen. Symptom onset was usually around 1 to 2 days post-vaccine receipt, and most symptoms resolved after 2 to 3 days. That was the median duration. Okay, herd immunity. I'm going to talk about herd immunity, and it's important due to its relation with vaccine and the virus. It is also known as population immunity or community immunity. It is when a large part of the population of an area is immune to the specific disease, or if enough people is resistant to the cause of a disease, in this case, the COVID-19 virus. Not every single individual may be immune. The group as a whole has a protection, as seen in this picture. For example, when you achieve herd immunity, on the picture on the right side, you can see that the green people are immune. So the disease itself cannot go around all these people because they are already immune. So what we are trying to achieve with vaccines is to at least reach 70 to 80% of herd immunity on the population. Okay? So this is important when we talk about vaccines, because this is the goal when we vaccinate people. We try to reach the 70 to 80% of the population for immunity and for the disease to stop its spread. So, herd immunity protects high-risk populations. For example, this includes babies or people that are that its immunity is suppressed and cannot create antibodies correctly due to its immune system being compromised. That's why it's important that vaccines exist. Thank you.